Well, joining us in the living room now is Janet from CHRISTUS Trinity Mother Francis.
And today she's going to talk to us about eVisits. How are you?
I'm doing great, thank you.
Great, thanks so much for joining us. So tell us what eVisits is.
Yeah. Okay, so eVisits stands for electronic office visits. So if you were ill and had something that was not a real severe condition, you may be able to get advice and information online from your doctor without having to go to the office.
So why is this so beneficial for patients then?
So it's beneficial really for those acute minor illnesses that are more of nuisance problems for most people, things that are not severe, not dangerous, but it's easier to be able to get care without having to go into the office. So you don't have to miss work, you don't have to miss school, and we can still safely provide quality care to you with a tool such as this.
Wow.
And why would you say eVisits is more important rather than, just coming into the doctor?
Well, certainly we have the option, and most patients prefer, if they have the opportunity and the time and it's not inconvenient for them to get to the doctor, they usually still prefer to just go to the doctor. And I don't discourage that. I think going to the doctor is very important when you're sick. But every now and then people are just really busy and they're struggling with time. It's hard to get time off of work to get to the doctor. So sometimes, especially if it's a condition that's not real dangerous or not real severe, we can do that via virtual office visit.
So how long does it take for the patient to get a response then? Because the people on the other end have to be pretty busy as well.
Correct, yes we are. So usually the calls are answered, or the eVisits are returned usually around lunchtime if they're done before lunch, or at the close of business at the end of the day. But a good rule of thumb is usually by the close of business the day that it's submitted, usually the doctors will provide, or the nurse practitioners or PAs, all of our wonderful other providers will provide information and treatment based upon what they see from the eVisit.
Okay.
And so why did CHRISTUS Trinity Mother Francis decide to start doing eVisits?
Well, we started doing that because we realized that the digitation of medicine is inevitable. And we also want to be able to provide other opportunities for patients, other portals of care for patients in a way that's convenient. We've recognized that this is a growing trend. There are other organizations outside of East Texas that are providing eVisits already, and we strongly believe that that care can be better provided by your own doctor.
So, go ahead.
No, that's okay. Your own doctor or their partner that knows your medical history, has access to your electronic medical record, rather than just a stranger in a different city.
Well, I was going to say, if someone goes on, they're talking to the doctor, they are sick and they need a prescription, how does that interaction work then?
So if they're sick, again, the way this usually works is we have a set number of conditions for which we will permit a virtual office visit. So take, for example, urinary symptoms. If someone thinks that they have a urinary tract infection, the virtual office visit is designed so what will happen is the patient will log on to the computer and then they're asked a series of questions. And these questions are designed to make sure that we really are dealing with a urinary tract infection and not something else. And they're also designed to make sure we're not dealing with something more serious like a kidney-related infection or something that really would require a face-to-face office visit. And so a lot of times we can provide quality care. Again, it's the nature of those additional questions that enables us to collect the necessary information to provide quality care. It's different than just calling your doctor and asking for an antibiotic over the phone. This is a situation where we are using strategic questions to make sure that we are obtaining the necessary information to provide high quality care in this setting.
Okay, sounds good. Thank you so much, Janet.
Thank you so much for joining us.
All right, we'll be